Welcome to another edition of Falmouth Cares Business Roundtable. I'm your host, Troy Clarkson. We're grateful to be back here with you for another week. As always, our panelists of local experts and thought leaders, Bill Zammer from the Flying Bridge Restaurant, Michael Kasperian from the Falmouth Chamber of Commerce, and tech guru Gary Vacon. Today, of course, as we record, is Memorial Day, so we'll start off the show before we introduce our guests by really just saying a very somber and profound thank you, and remembering those who paid the ultimate sacrifice so that we have the freedom and the ability to do shows like this and share with you our thoughts and opinions. So I'm going to just take just a couple of seconds of silence to honor those who have served and died. And we thank you for your service. And speaking of service, this week we are very pleased to have a couple of guests from our local medical community, Dr. Mike Fishbein and Dr. Peter Hopewood, who will talk with us about their understanding, what they've seen in terms of trends and developments over the last couple of months now that we've been doing this show. But as always, we'll start off this week's show with asking our local tech expert, Gary Vacon, to give an update on the trends that he's seeing and some of the data that's driving some of the public policy decisions that we continue to live with. So Gary, as always, thank you.
Yeah, thanks, Troy. Turn on share, enable sharing for me, and we'll be all set.
Who's not the tech guru, right?
There we go. We got it. All right. So we're going to go through the usual slides. Disclaimers first. This is all public data. You can see the sources. And in terms of sampling sizes and testing amounts, in the United States, so far, we've tested 4.33% of the population cumulatively, and we are testing 0.12% of the population every day. Massachusetts, quite a bit more, about twice as much, 7.71%, and 0.17% of the population a day. So, and it's not a random sample, so making a statistical inference is difficult. And if you've been watching the show for a while, forecast uncertainty remains high. I show this slide every week. This is kind of the growth factor. If you're 1.2, every day you're compounding your coronaviruses growing at 20%. We're growing about 1%, both Massachusetts and the U.S. now. So it's way down, and it's been hovering around there for a while. Here's the Massachusetts daily new cases up to date as of the end of the day yesterday. You can see the trend is moving down, and as we've talked about every week, you should look at these case counts as related to test counts, because sometimes they follow the test counts. So when test counts are way down and new cases are way down, you can't draw too much of an inference. But still, if you blur your eyes, you can see that we're creeping down kind of to an average of under 1,000 new cases a day at this point, and that trend seems to be continuing. Every week we talk about the University of Washington model, a forecast model that was funded by the Gates Foundation. I thought this was a really interesting slide that they put in over the last week. They actually did a survey, kind of a random sample. They asked what percentage of people say that they would actually comply to a mask rule. And it's kind of interesting where the compliance is high. It's obviously high here and not as high in other places. And they're using that data to inform their forecasts going forward. As far as their forecast going forward, this is the current Massachusetts numbers. Notice that this brown number down here, this kind of orangey brown number, is the number of tests we're doing. And this number up here, estimated infections, is what they think the real infection rate is, as opposed to what we're sampling. So they still think it's 5 or 10 times higher than what we're sampling. And they think this first wave takes to taper off till at least early July. This is their death rate forecast. But I'm going to jump right from there to the actual data, which is kind of interesting, which seems to follow. This is the Massachusetts data on actual death rates, which has been tracking fairly well. Hospitalization rates in Massachusetts are still trending downwards, which is also a strong indicator of things going better. Then I want to talk a little bit about the mass reopening plan, which was introduced last week. We're in week 1 of phase 1. We've just completed week 1 of phase 1 with a minimum of 3 weeks, according to the governor, before we go to phase 2. And I thought it would be interesting to look at why would you have a delay in that. Well, the idea is, I think that, exposure and infection based on the actions that we take, or just opening up a little bit, there's a possibility of more exposure and infections, but then it takes time for symptoms to develop, takes time for you to contact your doctor, I should say, takes time to get tested, and then you have to wait for test results. So it takes some time between the action we take and the results we can measure. So this thought, for instance, if there was a lot of contact between people over Memorial Day weekend, when would we see the results of that? Perhaps 2 or 3 weeks later. So when you're looking at the numbers now, you're looking at the results of kind of behaviors and actions 2 or 3 weeks earlier. As far as the dashboard is concerned, the public health data that they're using to make this decision to go to the next phase or not is trending down in all major categories. They're still indicating, the same green and yellow indications in each of the 6 categories that they're tracking. And just a reminder as a last slide that phase 2 is where we start to open up a bit of retail and restaurants on some limited basis, some lodging on a limited basis, and et cetera. So that's what I've got for today. I'm going to give this back to the group. Okay.
Great, Gary. As always, thank you very much. And yes, today was the opening date for some businesses in the economy. Those that watch the show every week will probably notice that I did have the opportunity today to shed a few hairs on the top of my head. And to transition our discussion to our guests, I'll talk about that for a second, because I went into Stone's Barbershop, where I've had my hair cut since I was 15 years old, and it was a very different environment. Usually that's a bustling gathering place where you get the news of the day and you know what's going on in town. But when I went in there today, there were only 4 people, and that was 2 barbers and then 2 customers. You had to go in by appointment. They used disposable capes, obviously all kinds of PPE and precautions and cleaning. So getting your hair cut, like most of what we do, is a very different experience today than it was several months ago. And Peter and Michael, I should say Dr. Hopewood and Dr. Fishbein, you've seen
Mike,
that.
how was your at the hair barber shop? Did you do okay? Did you leave a few
My
hairs?
last haircut in a barbershop was in 1977.
And that was his shoulders, not his head.
My wife has been cutting my hair since then.
Oh, that's wonderful.
Well, there you go. So, but other than that exception, those of us around the circle who continue to use things like that, I think we have to get used to, it's not even a new normal, it's just an adjusted reality for all of us. And so both of you working in the medical profession, I'm sure you've seen incredible changes and adjustments, but people still get sick, even with things other than COVID, and people have to be treated and people have to get well. So we'll start with you, Dr. Hopewood. Talk to us about what you've seen from your perspective and how the trends have changed and how it's impacted the work that you do helping to heal people.
Well, let me ask you, Troy, when you went in for your haircut, did they ask you if you had a cough or take your temperature?
Take my temperature? No. Ask me if I was feeling well? Yes. It's a little different for me because it's that barbershop's been in my family for 50 years. And so I Trish Stone, who owns and runs the shop now, I've known for a long time. And so we were conversing via text before I made the appointment. But I believe they were, when they scheduled people, almost like making reservations for a restaurant, they do ask those questions.
Yeah. So it's really been different between the office practice and then having the hospital practice, because we're still taking emergency room call and admitting patients. We're still doing surgery, but these are patients that will get sicker if you wait more than a couple of weeks. So it's symptomatic patients. But the office is very interesting because what we'll do is we'll pre-screen the patients on the phone for an appointment. We're still doing telemedicine, but the pre-screen is, are you feeling well? Do you have a cough? Do you have a fever? And then what we do is we have the patients wait in the parking lot, and we just bring one up at a time, and we see them, and then we let them leave, and then we call up the next patient from the parking lot. So we have like one patient in at a time in one exam room. We have to sort of clean the exam room down, and then before the next patient comes in. So that's, we're doing that. Telemedicine, as you noted before, we're able to do a lot of follow-ups on telemedicine, but as surgeons, I just can't touch I need to touch patients, I need to put hands on. We can do a little bit of video, for skin lesions and things like that. But in general, when patients are having symptoms, we need to see them. When they go to the emergency room, they all get pre-screened at the desk. And when they come in, everybody's wearing masks in our office, automatically, patients and the healthcare professionals. And then the emergency room, everybody comes in wearing masks. No visitors still in the hospital. This is a real issue because you drop someone off at the emergency room, you may not see them again for 3 weeks. And once they're admitted, they're in. And so then everybody wears masks in the hospitals. We test every admission in the hospital for COVID. And right now, the turnover time is very fast. As soon as it gets to the testing facility at Cape Cod Hospital, we have within a 4-hour turnover, getting a courier to take it there. So we're within 24 hours finding out if a test is positive or negative. And then that helps us because then we don't have to use all the protective garments and protective devices. The patients that we suspect have COVID, even if they have a negative test, we don't let the ball drop because we know there's about a 30% false negative rate on the testing. So we'll retest them. We'll retest them if that happens. If they're positive, we have a COVID floor. If we have a 100-bed hospital, they've converted the entire second floor now to COVID patients. And the other 3 floors of the hospital are non-COVID patients. The ICU has 2 COVID patients right now. As we speak. When we were in the midst of this, sort of in the end of March, we had about 20 patients with COVID in the hospital. I think we were up to 4 or 5 on ventilators. They were wicked sick. Let me tell you, patient, when they're on a ventilator, what you see on the TV and the news is real, that they are that sick. And they are like 1-to-1 nursing, two nurses for one patient. It's very, very labor intensive to take care of them.
Well, thank you for that. So, and I think that level of detail is really important because we've spoken now for several weeks about the policy side of this and the importance of social distancing and wearing a mask. And it's really been data driven, most of our discussions. But now today we have the opportunity to speak to you and really the data is still very important, but your real-time experience being in contact with patients who are very sick, I think is important for people to hear and to get that objective but very real and really, frankly, powerful perspective on what's happening. And Dr. Fishbein, your perspective is
Peter, do you see your patients putting off procedures and things that should be done?
Absolutely. We've had patients. Well, we have a lot of patients that came in at the front end of this. We weren't sure if our healthcare facility would be overwhelmed. So we have a lot of patients with minimal symptoms. Let's say you have a hernia and it's not giving you too much trouble. We would say, okay, let's just keep an eye on that. We'll call you in a couple of weeks. We called everybody back to see how they're feeling, do this on the telephone. There are some patients that would not leave their homes. We had a woman that came in over the weekend. She was she did not leave her home. She had very bad ulcers on her legs and feet. That came in, much more advanced care. Patients having chest pain and strokes. We don't know what happened to a lot of those folks because the emergency room went dark. I have to say, they had more doctors in the emergency room than patients through the middle of this. And we kept saying, well, where are the patients? Where are the patients? And Bill, I got to say, honestly, a lot of them weren't dying. I think a lot of them lived through symptoms and survived. And whereas if we had brought them in, we would have been all over them, taking care of them and doing procedures.
Will they get sicker because they're putting off some of these things?
Well, there's some diseases you get sicker, and some of them you don't. We've always been taught that if you have a stomach pain that doesn't go away in 24 hours, come in, check with your doctor. And what's happening is patients are waiting a little bit longer, and a lot of them do get better. It might be a bug or a virus, but we still see the appendix and the bowel obstructions, the intestinal hemorrhages, strokes and heart attacks, but not as many as we normally would have seen. and they're not going off Cape because they're all locked down.
Interesting.
It was very interesting. Very interesting.
That's fascinating. Wow. Bill,
Yeah, I just have a question. Like one thing that I would think would be fairly constant would be like appendicitis incidents and things like that. Do you have any sense as to whether there was a fall off in, routine surgical emergencies?
Yeah, definitely. There definitely was. And I think what happened, people legged it out at home and their immune systems worked out and made them better. We were always taught that, it's appendicitis, diverticulitis, diarrhea that doesn't go away, get checked out, and we would bring them in the hospital and intervene. And, maybe there's some other lessons we're going to learn on this.
Yeah, I was going to make that point, Armin. I think that maybe we will learn a lot because we're forced to everybody change their practice patterns. And now we'll be able to see the result of that change in practice pattern.
Yeah. I'm a little concerned, and we've talked about this among the staff. The United States pays the highest gross domestic product for healthcare, globally, and we don't have the best longevity, and we have one of the worst infant mortalities. So it makes you kind of wonder. We're spending all this money without great results, and maybe we're spending it in the wrong places. Maybe it should be more on prevention.
yeah, well, we've talked for several weeks now on this show about lessons we're learning and opportunities we have to really look at the way we do things from medicine to retail to restaurants. And we're learning as we go along. I think so long as we all, the six of us and beyond, remain teachable, there are real opportunities to come out on the other side of this a better society and in many, many ways. And so your input, both of our guests on the show today, is really important.
Yeah, I just want to make one
Someone has to pay for
regarding-
telemedicine. That's all there is to it. They're not paying for it.
I just want to make one comment regarding that, though, is that I still think that this is just all observational and we shouldn't really draw any conclusions at this point.
Yeah.
So people who clearly have symptoms that seem like they're serious should obviously still come to the emergency room and not assume that it will go away on its own.
Oh, of course. Yes,
Oh,
yes,
I want to make
Right
that
on the
yeah.
phone.
clear.
No, good point. Yes, indeed. That's still very important. So, Mike, talk to us a little bit about what you've seen over the last couple of months in the work that you do.
So my experience is different than Peter's because I work in the radiology department. And in fact, I happened to be away for 6 weeks prior to the shutdown, if you will. So I was gone from the beginning of February through mid-March. And so when I left, we were very busy in my department. There was just an inkling that there was a pandemic brewing. And then when I came back to actually work, I started working at the beginning of April. I couldn't believe how different our department was. Our volume was down 80%. We generally had 4 people working in the hospital most days, and occasionally 5 days. We were down to just 1 person working in the hospital and 1 person working from home. We were not doing any screening imaging, such as mammography, or we do screening for lung cancer and so forth. All of that was put off. And we really were just doing, I would say, emergency imaging and imaging for patients that had, that required, say, cancer imaging. So it was really, shocking. So we started opening up the, I guess our imaging a little more last week, and maybe we saw maybe 20 or 30% bump in what our patient volume had been, but it's still nowhere near where it typically is at this time.
Are you x-raying the COVID patients?
Yeah. Oh, yeah. So yes. So when we're not doing as much imaging of patients who have COVID-19 as you would think, because they actually don't require that much imaging. So mostly it's just managing their organ system failure, respiratory failure, and a lot of the other organ failure like kidney failure and so forth doesn't require any specific imaging. So we're not doing that much imaging on those patients.
How are the staff at the hospital holding up, Mike?
I think probably, Peter, you would probably have a better sense of that. In my department, I think the morale is actually pretty good, but I don't really see the entire hospital.
Yeah, the hospital, I mean, they furloughed about 600 employees, just over 10% of the employees. They should be back in the next 2 weeks. I think they're waiting for that second phase to reopen. The morale of the people working is good. The compassion level is very high. They're very motivated. There's a lot of fear among the healthcare professionals about getting COVID. And in fact, I basically felt that I would probably get it. Just wasn't sure how sick I'd be, because we have a lot of people, as you hear, are COVID positive, and they just, it's like having a mild cold, and other people get very sick. And we had one of our physicians get very sick. He's back to work now, but he was out for like 3 to 4 weeks before he was able
Peter,
to
are they doing antibody tests on you guys? And what do you think about those tests?
They're not testing us. We're not getting routinely tested unless we have symptoms. Two of my partners that were having symptoms, or their family were having symptoms, got tested, and they had a quarantine for 2 weeks. So we were down for a while they were out, but we didn't have any work. I mean, we were down 20% to what we normally do. And I was on the whole weekend, and I did one case, and it was an emergency case that had to be done, but otherwise it's very quiet. It's spooky.
Peter, can you define sick and real sick? You said people are sick. When do they get to that tipping point?
Well, they come in, I mean, it sort of can be very rapid, or it can be slowly progressive. They can start with a cough, a fever, and they just start feeling breathless, a little short of breath. They'll come to the emergency room, and then they'll find their oxygen levels are really low. They give them extra oxygen, and then then at that point they usually get admitted if their oxygen levels don't come up. But they're not sent home on oxygen. They bring them into the hospital, and then the majority of them do get better. I think that they're keeping a ventilator count in our hospital, and the last I heard, I think we had 9 or 10 patients with COVID on ventilators, and eight of them. We have 2 still on ventilators. We had 6 or 7 go home. We did have 2 patients that eventually died, but the family had decided to go on comfort measures only after being on ventilators for over a month. I mean, they didn't see any light at the end of the tunnel.
Wow. Okay.
But most of the patients who are on ventilators, Peter, survived.
They do. Most of them do. That's right.
Rest of the country, I mean, I've been hearing figures of 50 or 60% fatality if you're on a ventilator.
Yeah, but some of the quality of the survivorship. What we're seeing in the children, you're hearing about this Kawasaki's disease, or the multi-system inflammatory response. The adults get the same thing. They get inflamed hearts, inflamed kidneys, and the lungs are completely inflamed, and they end up with all types of syndromes after this disease, especially if it's particularly bad.
So this is, again, I think important to hear this, so that we know what we see on television and read in the newspaper is not just in any town USA. It's right here in Falmouth, in our hometown. So the precautions that we're all taking are still critically important. One of the things that we've seen in our community, and it relates to the question that Bill asked about morale, is the community really rallying together. And we've seen coverage of parades at the hospital to show solidarity and support for you guys and your staffs and the nurses, people paying for meals to be brought in. So this is to both of you. Talk to us just a little bit about that, because I think as dark as some of the days have been, we really have seen the community rally and show how incredibly supportive they are for the work that you and your colleagues do.
Mike, you want to?
Yeah, well, it's nice that you mentioned that, Troy, because on Friday when I was at work, I usually don't eat lunch, but I decided to go down to the cafeteria, and somebody had brought sandwiches for the entire staff. Everybody who was working there, and it was anonymous. I didn't even know who it was from. And just little things like that really resonate with you. And I have to say that it really gives me an appreciation of the entire level of care when you really sit back and you think about it. From obviously the people who work on the ambulances to the people who are cleaning the hospital, people who are taking care of all of our rooms, our laundry, every little detail. You see them now in masks, and you see everybody really as part of the same effort. And sometimes it takes something like this to really wake you up and pay attention to that reality. And it also helps me see what a critical element the hospital is in this community. And it's nice to see that people, I've always known they've appreciated it, but actually showing that appreciation in such an obvious way. So I see that as a very, very positive thing. And I think that whatever togetherness has happened through this pandemic, I hope that it continues.
It's a true team event. It really shows the importance of every member of the team and to come through this in a positive basis. When we have patients with bad lungs, the thing they call prone positioning. So for prone positioning is, if you heard of it, what we do is we put patients on their stomachs, because when they're lying on their backs, that portion of the lung gets less air and more mucus builds up in it. So because it's dependent on gravity, so they put them in prone positioning. Well, think of putting a patient in prone positioning on a breathing machine. We have about 8 people that are there, including physicians, to do that safely. And this is also for patients that aren't on ventilators. And some of these folks, are very immobile, they're very deconditioned, and they need about 4 people to help them. This is all a team event. And this is all types of people. Now, there's no volunteers now in the hospital. These are all people that are healthcare professionals that are there doing this.
Just amazing. So it's and I like the phrase that you use, that it's a team event, and that's really what we've seen in the conversations we've had over the last couple of months, is from medicine to restaurants to retail to the faith community. It's really been multiple team events that have really kept this community unified and with a singleness of purpose. And a big part of that has been supporting the work that you guys, again, and your colleagues do. So I know you've heard this many, many times, but we thank you for doing what you do and keeping us safe and healthy.
I know you fellows don't have a crystal ball, but what are your thoughts about people that are not adhering to the masks and the precautions? And we see it all over. My wife was in New Hampshire yesterday, and the home goods store had lines out the front door, and the place was packed. No one's paying attention. No one's wearing masks. How long do you think this is going to last? Or what's going to the transition as we come into summer, into fall? I know you don't have a crystal ball, but what do you think of what's going to happen?
Well, part of that's the unworried well. And I think what I'm seeing is, and this is sort of like patients, I see a lot of cancer patients, patients that don't get their screening colonoscopies or their mammograms. It's because they haven't really known anybody or experienced anybody in their family that have had those diseases. So I go around, ask everybody, how you doing? Are you well? Almost always hear everybody's fine, no COVID. And then once in a while you talk to a nurse and her whole family had COVID, or you talk to another person whose mother died of COVID, or 2 aunts died of COVID. So I think what's happening is that people that aren't wearing masks don't know anybody that's been stricken by this disease. And it's just a matter of time before that happens. And it's like, it's not Russian roulette, because every chamber of the gun is loaded. It's just waiting to pull the trigger before you get it. And like I said, I don't know about Mike, but I fully expect to get COVID somewhere down the line, and I just hope I don't get sick from it.
Yeah, so I don't think anybody obviously has a crystal ball, and there have been a lot of things that have been very perplexing about the spread of COVID-19 to me. Like, I would have expected Florida to have exploded. They have a very elderly population, tons of nursing homes. They didn't really practice, extreme social distancing as far as I could tell. And they haven't had a very high rate. And if you look at the band of infection, it's really, Italy, Spain, UK, United States, pretty much all in the same northern latitude belt in a very narrow range. It makes you wonder whether there's something about that particular latitude that has allowed this disease to spread the way it has. Maybe it's the fact that more people were indoors, and maybe in Florida they're outdoors. There are just so many variables that we just don't know about. But one thing is certain is that nobody has been exposed to this disease. So everybody is susceptible. So the spread is going to be dependent upon the ability of that virus to spread and the amount of mixing that occurs among people that have the virus. So if there are more people with the virus, they're mixing with people that don't have it, even if the rate is relatively low in certain regions, it's going to continue to spread. It's not going to stop. So I'm very worried that, about people who are not taking it and practicing social distancing, because we know that it does work. And we see what happens when people don't practice it.
That's right. It's that super spreader events, which, that choir in Seattle, one person got 50. In Spain, it was a women's march for voting rights or something like that. That happened the day after Italy locked down. I think Italy had a soccer game everybody was exposed to. One soccer game. And Boston had the Biogen conference. I mean, these were all, trigger events where hundreds of people got exposed and came down with the disease, and it just mushroomed from there. So I think that's
Testing.
That's a big thing.
You suggest testing. We have testing sites now open in Falmouth. The CVS apparently is testing in East Falmouth, and urgent care and a few other places.
Mm-hmm. That's right.
What are your thoughts on that? Should we be tested?
Well, I mean, I don't know, Mike.
What was the question? I didn't hear the question. Who should
Should we be tested?
Gee whiz, that's a good question. I don't know. I mean, if you ask me my opinion, it's just my opinion. It's not really what's been practiced. But I honestly think that it would be a good idea to test just about everybody every 2 weeks. Now, I don't think you have to do that in areas where you have really zero disease. But in places where it's still fairly prevalent, I don't think that would be an unreasonable thing to do, because it spreads, we know, invisibly. There's a latency period where people are asymptomatic and still capable of spreading it. A lot of people don't show any symptoms ever. So how are you going to detect when this disease is spreading if you don't test? Otherwise, you just have to wait 3 to 4 weeks. And by that time, you could have a super spreader event without even being aware of it. And the disease could be spreading throughout the community. So I think the safest way is to test as many people as you can and as often as you can.
Yeah, we've had 3-4 patients with COVID in our office. And the staff really were very uneasy about this, but they were all in the office over 14 days or longer before they got sick. So we were able to feel good. But I think Mike's right. I think if everybody got tested, then you can track the contacts, and then we could do contact source control like that. But we're only what's the numbers again? We're only testing 1.7 per million in the population in Massachusetts.
Yeah, Massachusetts is doing better than most states. We're, I think, in the top 2 or 3, but we still only tested, like, in total, cumulative, a little over 7% of the population, and we're only testing 0.17% of the population every day right now.
Mm-hmm.
How do you make that happen?
Well, yeah.
You need the tests, right?
That is a challenge. Michael Kasperian, to throw it to you, Dr. Hopewood used a phrase that really resonated with me, and he used the phrase, the unworried well, right?
Yeah,
and
phrase.
So in your role as the president of the Chamber of Commerce, the season unofficially kicked off this week. And I think in our conversation before the show started, we're already seeing some of that. So groups of people who are taking precautions and wearing masks and keeping safe social distances, but others who aren't. And as the leader of our business community, what are you seeing in terms of that?
Well, I think that's a good point that Peter brought up. And I think that if you look around, anybody who was driving around this weekend could see that there are people who are physically distancing, wearing masks, and then there's groups of people who are not. And that's a big concern. Obviously, we're in this balance where we have to take into consideration everybody's health and welfare and make sure that things are opened when it's proper to do so based on that. But we're also running against a clock where we need to get the economy going if our businesses are going to survive. As you know, and we've continued to talk about on this program, so many of our businesses are seasonal. So the fear that I have is that if people relax too much, let's say in 2 weeks it's a go, which we're hoping it is. We have our fingers crossed. We still don't have specific numbers from the state as to what percentage of tables are going to be able to be used in restaurants, et cetera. We're working on that, trying to get some of those answers. But if people don't practice the social distancing and covering, and the numbers continue to go the other way, and the state goes back to phase one, that'll be devastating. And I don't think I can say it enough that the situation, the business situation, is dire. There's no other way to say it. It's dire. I mean, there are some industries that are doing well, and some industries that are probably doing even better. But the majority of our businesses that are focused on this, seasonal type of business really is being challenged. And right back to Peter's point, if people aren't taking that responsibly, it could turn things around. We're getting calls constantly. They're more and more. Are you guys open? Is the beach open? We're coming down. Are the hotels open? No, not yet. Well, we'll come for the day. And that's all great. But if you have people walking up around and not practicing what they should, not only are they going to get each other sick, they're going to get the community sick, and then long-term effects are going to be pretty terrible.
And so that's really the balancing act that we as citizens, but Michael and you, Bill, as a business owner, are faced with. Bill, what are you seeing? I mean, so your restaurant started takeout a couple of weeks ago, but are still trying to work that balancing act between being responsible and needing to have the business open, not only to be successful, but because there are many people who work for you who count on that income. So how is that all working for you?
There seems to be a target date of June 8th. The Mass Restaurant Association, I was on a call with the lieutenant governor, and to attempt to open outdoor seating, but maybe even open indoor seating. But I'll give you a funny number. It's kind of silly. They're talking about opening 25% or 50% of the place. Let's go back to productivity. If I've got a restaurant, or in this case, a restaurant, and I've got one manager and one bartender and two cooks and two waitresses, that group of people can do 100 dinners. Now, if you tell me I'm going to do 50% of what I can do, and I'm going to do 50%, I still have the same payroll that I'm going to have to do the 100 dinners. So this productivity aspect comes into it. So businesses can't survive by saying, not the politicians, but the rules saying, okay, you will operate at 50% or 20% of your capacity. You operate at capacity so you can control your costs. And that's going to become a real dilemma. I think a lot of people are going to try and open, and it's going to cause them to go down even further. They're going to lose money. There's no question in my mind. You can't quite open at those levels. The distancing part in a restaurant, I'm very fortunate. Obviously, the Fire Bridges, I can put tables out in the harbor for where I've got so much room over there. But the smaller restaurants can't survive, which will go into Mike Kasperian's point with Main Street. You take one of the smaller restaurants, you say, okay, you're going to operate at 25 or 50% capacity. They're not going to make it. It's not enough, particularly during the season. So the whole opening of Main Street issue becomes a survival issue for some of those places, even though the retailers may not like it. So the dilemma is what do you do at this point? And so June 8th is a target date for partial opening. It helps. But again, at some point, you got to say you open and you use common sense as to what you can do. We bought all the precursor stuff of opening. We bought all the signs. We've got the plexiglass screen for the front of the place. We've got all kinds of the PPEs and the gloves and all that good stuff, which, by the way, cost a lot of money. The hand sanitizers, we're doing all that. We'll have extra payroll on to clean the place. But to me, as I've told, I just should go to sleep now, wake up next April.
Yeah. But, to Bill's point, and you're absolutely right. See, part of what he said earlier was like, if everybody just did what they were supposed to do, this could all work. The rules that are put in place, face mask, washing your hands, socially distancing at 6 feet apart when appropriately. If everyone followed those rules, these businesses could reopen. And, not only the restaurants, but if you think about all the retailers, they're carrying, in some cases, tens or hundreds of thousands of dollars of inventory. Think about some of the retailers who had spring inventory that, guess what, they haven't sold. And now we're into the summer and they've got spring merchandise. And, the problem is, if you have a few bad actors that don't follow the rules, it could ruin it for all the other people who are following the rules, and it could be devastating for this community.
So really, it's about, Gary, it's about resisting the marshmallow, right?
It's about resisting the marshmallow
Marshmallow.
experiment, right? You guys read the Stanford marshmallow study, right? They put the marshmallow in front of the kid, and
Well, Gary, let's hear it again. So
the adult leaves the room and puts one marshmallow and says, "If you will not eat that over the next 2 minutes, when I come back, I'm going to give you 2." There was a longitudinal study, and they correlated success in life with the kids that, very young kids that could resist and waited for the 2 marshmallows. But I think too, this conversation, this is really a good conversation to have doctors and business people on the same call. And poor Michael, who is in the crossfire, by the way, and I really appreciate what you do every day. And I mean, Michael Kasperian, he's getting torn both ways on this. This is as much an experiment in virology as it is an experiment in human behavior. I mean, what are we going to get? Boy, I don't know. I don't know what to expect.
But that's a really good point, because I think right now those two disciplines are inextricably linked, because to the degree that we're unable to resist the marshmallow, it's going to continue to put pressure on our 2 guests today and all of the people with whom they work. And so at some point, I think Gary Vacon's going to get a byline in my column, because he continues to share some great information with me that I then share with our readers in the enterprise. And we talked, both of us, this week in my column about the resisting the marshmallow. But it's very real. I mean, we were able to put it in a way, I think, that made it hopefully enjoyable and interesting to read. But that's a critical decision that we face. I just, before we started taping, I had the chance to see my parents, who I hadn't seen in several months because they were in Florida. First time in my life, I spent time away from my mother at a safe distance, wearing a mask, and it was uncomfortable. But I and she and my stepdad recognized that the price of survival is that sort of vigilance. And I think there are many of us who are unwilling to pay that price of vigilance, and that. So that's the period that we're in right now, where the weather's getting better. We've been cooped up for a long time. People want to get out there, but without the continued vigilance and that sort of discomfort, then we could be right back to where we were in late March a few weeks from now. So that's open
to our viewers. They should definitely Google the marshmallow experiment. First of all, it's very interesting, but it's also you get a few laughs out of it.
Yeah.
The other question that comes up too that's kind of interesting is, so our community is also, made up of the folks who live here, 32,000 people. Then you've got the second homeowners that come down, and then you have all the tourists. And when you're coming down for the day or for a week, or you're in a different mindset. You're on vacation. You're coming to the beach. You want to hang around. And I think, human nature, it's probably a lot easier to be more relaxed and be like, I'm outside, the sun's shining. As if we were like a landlocked, year-round community, I think it'd be a lot easier to keep that message consistent and to keep more people, on task. But it's hard. It's very difficult. You got people from all over with varying degrees of seriousness on what they're thinking, and trying to keep everybody on the same page. Very challenging. Very challenging.
I mean, one thing that I think is fortunate is when this pandemic started here in the United States, we were very unprepared for it in terms of protective equipment, hospital capacity, ventilators, so forth and so on. Plus, we didn't know some of the things that we know now about treating this disease, as well as the effects of social distancing. So I think we're in a better place now, at least in terms of being able to deal with this, than we were several months ago. Now, having said that, we're also, several months ago, we were starting with really 0 patients. Now we have, a couple of hundred probably in our midst right now. So the disease is out there. We have to be vigilant, but I do think our medical capacity to handle it is better than it was several months ago.
Yeah.
There is this worry. I know the infectious disease people on the Cape are worried about the late summer and fall. And if you think of it this way, on a summer weekend, there's more people on Cape Cod than in the city of Boston, because everybody comes down. So we end up with this back to the super spreader event. We have all these people down here, and then we have a 2-week lag before everybody starts getting sick. So if you think of, what could potentially happen if people don't, wear masks, do social distancing, and the floodgates open to Cape Cod, then we can be in for a real shocker again in late August or September.
The other thing too is that, and Peter, you're aware of this as well, is that in the fall we're inundated with flu. People don't really appreciate the impact that flu has on our hospital. So, usually in end of February, pretty much a lot of our imaging is related to take care of imaging people who have influenza. So, with the capacity almost at maximum in February as it is, I think we'll be not in a great situation to be able to handle excess number of sick patients. So that really concerns me.
Yeah.
So I liked, Gary, the phrase you used. It's an interesting, really sort of a convergence of human behavior and infectious disease study. And that's really where we're at right now, a very uncertain and interesting time, because what we do will really determine how our future looks in many ways. And it's
and one thing it's interested me is how compliant is our culture in this country when it comes to things like this. Any impingement of personal freedom is something that our culture doesn't do that well with, compared to, for instance, Asian cultures that tend to do better. So, are we willing to do what it takes to get through this?
Well, that's an interesting point. So, therein lies the question, is it my individual right to not wear a mask and walk around, or is it your individual right to ensure that everyone wears a mask? So, it depends on your perspective, doesn't it? It's very interesting when you start getting into rights, and, I'm not going one way or another, but I'm saying, it's easy to justify how you feel either way. But in the end, really, isn't like the health and welfare of the entire society should be paramount, number one?
Well, I think it's really interesting to listen to Peter, somebody that's been on the front lines and cared for these patients. I know Peter's discussion today touched me deeply, and I really appreciate it. And Michael's, it's hearing from the front line, and there's a big difference between hearing from somebody that who's seen it and talking about the numbers in the abstract. There's a big difference.
Without a doubt, I think I felt the same emotion, Gary, that you did when Peter was speaking, because particularly on the work that we do here in the show, you do a great job every week, Gary, of giving us those statistics and the trending, and that's critically important to understanding the importance of social distancing.
Right, but it's just, sometimes a death count is just a number on a chart. It isn't.
And to hear it from someone who's on the front lines, and to hear someone very openly and honestly, exposing their own concern that they may get sick, but still you suit up and show up and go to the hospital every day expecting to get sick. And that's extraordinary for me to hear that. And I hope the folks watching realize how extraordinary that is for all of our healthcare workers, right? That are putting, and Mike, you mentioned it, and I think that was really important too, because those of you that are directly involved in patient care are on the front lines and potentially exposed. But there are people throughout that organization, from the people who do the laundry and the people who work in the cafeterias, and it's you guys get a chance, Mike and Peter, to see that every day. But those of us that are a step removed, it's easy to forget that there are thousands of people just here on Cape Cod who are putting themselves in danger every day. And I don't think we can overstate how important it is that that sacrifice that you guys are making.
Well, it's not just us, and I think I just want to speak to something that Mike said, is that, we have a responsibility to protect everyone in our community. So, I mean, I think all those people that are working in the shops and restaurants and so forth and so on, I mean, I don't want to walk out with the virus and expose any of those people to an infection. And I hope everybody has that attitude. You don't wear the mask just to protect yourself. You do it to protect others in the event that you have it and you don't want to spread it to other people. And I think everybody who's in a retail store is exposing themselves to an enormous risk. And I think that we should recognize that.
I think one of also the unspoken impacts of the social distancing, specifically as it relates to medicine, and Peter, you mentioned this earlier in the show, is that a huge part of healing, from my layman's perspective, is the comfort we get when we get sick by having our loved ones around. And so when people get sick and have to go into the hospital now, that is not a factor. That's not a dynamic that's available. And have you seen the impacts of that? I mean, so your patients that are there in the hospital are obviously have the doctors and the nurses and the PCAs there to comfort them, but they don't have family, and the impacts of that have to be real.
It's very, very difficult because the families are panicked because they don't really understand what's happening. They can't see their loved ones. Honestly, a lot of older people don't have FaceTime, don't have cell phones that they can see face to face. And even then, the nurses sometimes try to do that with them. When I personally call every spouse or next of kin for every patient I have in the hospital every day, just to tell them how things are going, because they really appreciate, they're hearing it from me. Sometimes they try to get it from the nurse, but I can kind of give them better direction. But one of the worries is we don't know when they're ever going to allow visitors into the hospital. So now we have a hospital that all the patients are COVID negative except for 2 or 3 that we know are in the COVID floor. And then are we going to allow visitors into the hospital? How are we going to screen them before they walk in and potentially have COVID and give it to the patients in the hospital? So they're going to have to be pre-tested. I mean, clearly temperatures, symptoms. In the emergency room, the same thing. You bring in a spouse with chest pain or who's had a collapse at home, and you have to drop them off at the door, and you don't know what's going to happen to them. And sometimes bad things happen, and usually not. And the people are completely panicked and frantic and want to be with their loved ones.
Peter, the business community is going to also have to step up to be sure when they come into a business, a restaurant, that the folks coming in we've got the temperature checks and to see how they're doing, not to let them in. It's going to be incumbent upon us to save our businesses by doing the same thing in a way. We don't want them in it. And again, how do we do that? It's going to be very difficult.
Well, think of it. My wife works at the bookstore, and they're struggling with, are they going to allow people to touch the book? So if you go to retail clothing stores, to touch the clothing. Where you know that the virus on these fomites can last up to 6-12 hours. Hard surfaces more quickly than soft surfaces. So. And you're seeing now in the Airbnbs, they're saying that they want a 24-hour lapse between people being in apartments, to give it time for the virus to die. I mean, what's the science behind that? You want to tell us?
I have no idea.
I have no idea.
Yeah.
I have no idea. That's a good question. I mean, I've read various studies on various materials having different half-lives, but I haven't read anything that I thought was totally definitive.
Mm-hmm.
Well, but see, that's a great point, right? Because and both Bill and Gary answered that question very honestly and said they didn't know, and that's one of the greatest challenges for us because there are so many unknowns right now. So we're trying to make responsible public policy decisions based on data, but also based on evidence that's inconclusive, and so it's really unprecedented. And Michael, in your work at the chamber, you see that every day. And so trying to sort out how much is too much and how much is not enough without any definitive answer in any way.
Like Michael said, we know more now than we knew six weeks ago, right? 7 weeks ago, 8 weeks ago, medically, socially, as we continue moving forward, we're going to learn more, and hopefully we're going to get smarter and figure this thing out. Be better prepared for the next novel virus that comes along. But yeah, there's just too many unknowns. And, the big concern is just, a couple of bad decisions and could turn it back the other way.
Right. I think the phrase that Dr. Hopewood used, super spreader events, and we really have to be really aware of and concerned for events like that in our community. And a couple of weeks ago, we had folks from the nonprofit community and some of our policymakers. We've had a couple of selectmen and, of course, our congressman on. And that, the pressure is on them to continue to make those decisions that prevent those super spreader events. I'm sure we all saw the picture widely circulated on social media of the resort somewhere in the Ozarks where,
Right.
I didn't see a lot of social distancing there and not a single mask. And so that continues to be a challenge as we go forward. And right on cue every week, Bill shares our Falmouth Cares logo. And so for our guests, this effort, this show began as really an informal roundtable of a few of us sitting around having a chat. And what has grown from it has been a pretty amazing local effort. And thanks to the work of lots of people, including Bill and his wife Linda, and Sam and Judy LaRusso, and Gary Vacon, who along with a friend came up with the logo that you see behind us. We've launched the Falmouth Cares effort, and to date, through T-shirt sales alone, have raised nearly $10,000 in our community for the Falmouth Service Center and belonging.
Over that.
What's that?
Higher.
So make more than $10,000.
That's right.
So I can be like an auctioneer. Do I hear 11? 11, 11. Do I hear 12? But
like the golf tournament did yesterday.
Yeah, right. Well, we can get. I can say on this that I might have been secretly rooting for Tiger. I try not to have resentments in my life. I couldn't bring myself to root for Tom Brady. Anyway, Peter and Mike, you are both involved in many organizations that just do good things beyond your professional work. So the value of community when it comes to trying to give back and be helpful. And I think all of us, the panelists, have been overwhelmed at how we've seen the community rally together and people wearing their Falmouth Cares T-shirts and taking pictures and hanging the banners that Gary so generously donated. And it's really been amazing to see, despite the challenges of losing loved ones and people getting sick, we've seen the best of humanity and people really come together. I'm sure that both of you have seen the same thing. You talked about a little bit earlier at what you've seen at the hospital, but I'm sure you've seen it in the community as well.
We have, and that's been it's been a, in all the darkness here, that's been really one flash of really bright light. It's been really wonderful.
Yeah.
Yeah.
Agree completely.
Thank you for all you're doing.
Yeah, thank you guys, gentlemen. I can't tell you how much.
Every week we try to bring some kernel of information and truth and accuracy to our viewers. And as much as I appreciate all the guests that have been on this show in the weeks prior, I think today has been especially important and poignant because we get to see the reality of this disease and how important it is to continue to social distance and be responsible. And it's nice to get a haircut, right? But it's more important to be healthy. And
Right.
and we'll continue to discuss that in the coming weeks as this unknown period progresses. Dr. Mike Fishbein and Dr. Peter Hopewood, any final thoughts as we wrap up?
Well, there was this great article in the New York Times a couple of weeks ago on how pandemics end. And if you haven't seen it, you can look at it two ways: science, the virology, and fear. And the fear can be, as the fear decreases, hopefully it's because we have more knowledge about the virus and how we're able to do it. So it may end up that we end up with an endemic, which means that we're always going to have this around, but it's at a very low level, like Ken was saying, an acceptable level where we can accept it. the risks and benefits of being at a low level. And that's the key, getting to that point.
Yeah, I guess the final thing that I would say is that I think that if there's any hope in this being conquered, if you will, I think it's going to rest with science and data. And I just hope that we continue to follow the data and follow the rules as indicated by that data. And I think if we do that, we'll be in far better shape than if we don't.
Amen. And we will continue to bring you that data and that information on a weekly basis to just try to be helpful and share it with all of you so that you can make good decisions. We really thank you for joining us for another week. This is the Falmouth Cares Business Roundtable. And for our panelists, Bill Zammer, Michael Kasperian, and Gary Vacon, I am your host, Troy Clarkson. It's been great having you with us on this Memorial Day. Thanks for watching, and please, stay safe.
Thank you.
Stay safe.
The Falmouth bells were tolling, and our hearts sang on. Was it the spell of our town, or an April dawn? Who knows if we shall meet again? But when the morning chimes ring sweet again, I'll be seeing you in all the old familiar places that this heart of mine embraces all day through. In that small cafe, the park across the way, the children's carousel, the chestnut trees, the wishing well. I'll be seeing you in every lovely summer's day, in everything that's light and gay. I'll always think of you that way. I'll